It's a completely different topic compared to the one previous one which I have presented. So I'm just coming non-clinical now compared to the clinical one which I have started. So artificial intelligence is just like, what is an artificial intelligence? So it is an hardware or a software or a computer. Usually they will, if you give any program, it will start multiplying, addition, anything it will do. But if it starts thinking like a human, if it start adding where I have to do, whether I need to do addition, whether I do to subtraction, if this exhibits the behavior, then we say it as artificial intelligence. For example, if you give the machine like a list image what you are seeing, and if you say it to identify, it's very difficult for the computer to identify. And when we add an artificial intelligence software to that to identify this cat, that becomes the importance of AI in the machines. So they have a various, it has progressed over a period of time. It has progressed very extensively. So they have something called as machine learning, where initially we need to give the data, and then it will start identifying whether the disease or any condition is there or not. Or nowadays we have something called as deep learning and convolutional neural networks, where initially we need to give the some data, then it will automatically evolve itself to become much better and better. So what are the applications of this? I'm not going more into the what is the deep learning and all. So what is the application of the artificial intelligence nowadays we see? So it's very commonly every day we use it. So for example, whenever in the Google you put it anything, you search it, the next day whatever you open, the ads will be there on the same condition. That's in the Google what they do the web search. And any Netflix or anything, whichever you are seeing the movie or any series, the same series they start showing it to you. And nowadays the recent also the Tesla is going with a autonomous vehicle, automatic cars, all these things, the image detection is based on AI only. So coming to the health, the most important application nowadays is happening in the case of radiology, because the most important for any artificial intelligence is data. And radiology has a lot of data with CT, MRI and all. Ophthalmology also, yes, we have a lot of data. And medicine and oncology also. So where are the applications in the medical science? The most important in being the, like, if you come to the patient comes to the OPD with certain symptoms, and if you tell the patient AI that this symptom is there, it will automatically triage it to which doctor he has to go, or this thing, any investigations any required. So automatically it can help to triage. Yes, it can help to for the patient diagnosis and prognosis, and nowadays the new drug delivery and also other conditions also it is helping us to do. There are like lot of studies has come on artificial intelligence in the retina. So there are like few of the studies which I just put to show that there are lot of work is going on in the artificial intelligence, and it will be the further future, like it can be a further future like this thing will happen. So any artificial intelligence requires lot of data, means you require lot of images. So in the retina, if a fundus photograph, they require a lot of images, and nowadays it is a ready-made images we get. There is something called a data sets, and especially Kaggle and IPAX has kept lot of images where you can see 53,000 and 35,000 images of diabetic retinopathy, which has been annotated. They have kept it ready-made for anybody to work on it. So retina has a lot of opportunity because we have a lot of data with a digital fundus photo, OCT, B scan, and OCT angio. So there are mainly three principles what we use for that AI. So one thing is a classification, where the study is done to say whether there is any DR is there or not. That is a classification based. And next is the segmentation, where whether there is any hemorrhage is there or not, or whether there is any leakage is there or not, or soft exudate is there or not. That helps us to do through segmentation. And the prediction, so if the patient has mild NPDR today, over a period of 1 year or 2 year, whether it's going to become moderate NPDR or PDR, that is the way the other classification they are trying to utilize in the prediction part of it. So in the nowadays the EA in the retina we are using most commonly for the diabetic retinopathy, and especially for the diabetic retinopathy screening, especially somewhere in the far in the periphery, a technician can go take a photograph, and the machine will say whether the DR is there or not. As you know, there is a lot of diabetes is increasing nowadays, and this helps us to screen for the diabetic retinopathy also. And in this way, US FDA has approved the first one in IDX DR, which has a typical, if you take a photograph and if you give it, it will say whether it requires any referral or not. If there is any diabetic retinopathy is there or not. So in India, we have mainly three. One thing is the Visu Scout, where it has something called a Visu Health software, where it is having a non-mydriatic fundus camera, where it will take the photograph and automatically from there you can AI can tell you whether any DR is there or not, whether it's referred to the doctor or not. If the image is not clear, it can be sent to the doctor also, where he can say whether any diabetic retinopathy is there or not. As I told you, it aids in the identification of the early signs and warning for any other conditions also. Similarly, Remedy also has its app where it will also show classify whether DR is there or not. Nowadays, what we having the applications now right now, it should tell whether DR is there or not. We don't have the application to say it's mild, moderate, or it is DME is there. Still, we have not got that application yet. So, and they are told the sensitivity of 100% of detecting diabetic retinopathy. So there like various studies are going on with the help of retina images. The Google Mind has tried to see to predict the heart rate attack with using the using the retinal fundus images depending on the hypertension and all. So these are the other applications which have been approved for the AIDR. Coming to the DME, so nowadays there are many softwares are coming to identify the DME part of it in the AI, where they'll mix the fundus photo and the OCT image, and they say whether the DME is there or not. In the future, what happens is like take only the fundus image, and it will say whether the DME is there or not, based on the previous data of the OCT part of it. So these are the certain how it calculates. It just takes the OCT image. It will extract the whichever is required, something called as heat maps. It will extract that area, and then it will lot of data. It can say whether the DME is there or not. So even nowadays, the lot of AI is going on the retinopathy of prematurity, where in the IROP system they have shown that the 96 and 91% chance of detecting the ROP and clinical significant ROP. Here, what they do, once they take the photograph, the AI will extract only the vessels, and then it will see how much far the vessels is going. Based on the previous annotations and previous data what has been given, it will identify whether it has to be referred or not. So this is another showing the deep learning how much is the various study. So it has also been helped in the age-related macular degeneration also. So where we can identify whether there is a wet AMD or dry AMD. Also it helps us to predict whether the geographic atrophy is progressing over the future 1 year or 5 year, how much it is progressing. This is one of the study which is showing the CNN model which showed 100% sensitivity and 91% specificity. So this is the way how they went to see whether it's a normal or a AMD, if there is a AMD with exudative changes or non-exudative changes. This is something called as heat maps. So identify whenever you take the images, what the machine will do, it will only identify where is the problem is. Then multiple data, it will just identify where the problem is. Then it will try to say whether there is a pathology there or not. So this is the study which is showing the progression of the DM, whether it can able to predict clearly how much is the progression of geographic atrophy is going on. But in this, the sensitivity is very less. So AI in OCT angio also has been used nowadays, so especially for the image reconstruction or the image enhancement, so that all the projection artifacts which are there, it will help to decrease the artifact removal also. So this is the way, something called as convolutional neural networks, which has lot of hidden networks. It's just, we can say it's like our human neurons. They have kept multiple connections between the this thing processing, and it will help us to clear the artifacts. It will also help us to image the disease detection. There is recently one paper has come, something called as DCARDNet, where they have tried to do the diabetic retinopathy based on OCT angiography. And they have...
Can you summarize?
Yeah. So the limitations are also is there, like the diagnostic accuracy is better, but there is something called as black box issues and other, like false positivity may be higher. So you should be very careful. Now still it has to progress, evolve to see whether this will help us or not. And there is also a risk for doctors to become addicted to the technology and lose their diagnostic abilities. So thank you.